Welcome to our Corporate Experiences STEM series featuring a virtual field trip to Sonrisas Dental Health. My name's Dee Dee, and I'm your host from Wender Weiss Foundation for Children. And we are partnered with Sonrisas Dental Health and Sequoia Hospital to bring you this event. We are excited to be here with students and teachers from high schools in San Jose, Santa Clara, East Palo Alto, and Redwood City. Some live and some asynchronously. So welcome to all of you. We're going to begin by just quickly sharing the agenda. Just to kick things off, I'll let you know we are entering the world of dentistry with you guys. And we are highlighting connections between oral health and overall health with Dr. Bonnie Ju. In addition, we are introducing you guys to a panel of dental professionals, some in entry-level roles and others in advanced roles, but all of whom will be sharing stories and advice from their career journeys and how they got started, how they decided on dentistry, that kind of thing. Next, I am going to switch over to an orange QR code, and we would really appreciate it if all of you would scan the QR code and register and just let us know you're here, your name and your school. Finally, just wrapping up the agenda, we're going to be closing out with the question and answer session, and we are recording today's session so that we can welcome all of our students asynchronously who are joining us on another day. So we're excited to have you here. With that, we're going to kick things off. We will begin with a welcome and introduction to Sonrisas Dental Health from the Community Engagement Director and a dentist, Dr. Bonnie Ju.
Thank you, Dee Dee. Okay, hi everyone. My name is Bonnie Ju, and I've been a dentist for over 28 years, and I love talking about teeth. So thank you very, very much for being here today. I work at a nonprofit dental center in San Mateo called Sonrisas Dental Health. We are just like a regular dental office, but with kind of a social justice twist. Most of our patients are low-income community members in San Mateo County who find it challenging finding affordable dental care in their neighborhoods. So we try to help fill that gap in providing care for people who need it the most. My role at Sonrisas is to coordinate our outreach programs in the community that promote oral health education, and we also do free dental screenings like checkups to children in the county. That's always a lot of fun. I go to schools, I bring my team and my portable equipment, and we actually provide some dental services right there in their school playground. I'm so happy to be here today to talk to you about all of these different aspects of oral health and dentistry, including the career options in the dental field, as Dee Dee had mentioned. So let's go ahead and get started. After this video that I'm going to show you, I'll be here to answer any questions that you have, and I'm really excited to be with you here today. Here we go.
I labeled this presentation, I usually call it Healthy Teeth Equals a Healthy Life, because dental health and oral health is actually really connected with our overall general health. There are certain medical conditions that are affected by how healthy our mouths are, and vice versa. What happens in our mouth can actually affect other parts of our body. So some things here that are on this picture listed are diabetes, heart disease, strokes, and of course, tooth loss. And when we talk about heart disease, the heart is the central part, pumps everything, it kind of runs our body. And the bacteria in our mouths, the mouth is connected to the rest of our body. So we have germs in our mouth. It actually can get dislodged and enter the bloodstream and lead to sticky plaques that line the inner blood vessels that are going to the heart and can actually increase our risk of heart disease or stroke, all because we're not brushing enough. Now, of course, it's much more complicated than that, but wouldn't it be terrific if we could, help our bodies out just by brushing and flossing our teeth, which help keep our teeth too? The other type of condition that people have that is directly linked to our oral health is diabetes. Some of you might have some family members that have diabetes. And 1 in 5 cases of tooth loss, that's 20% of people who lose their teeth, is directly related to their diabetes. Diabetes is a medical condition in which your body can't utilize the sugar properly. So instead of the sugar helping fuel your muscles, it actually ends up in the bloodstream. And that's why you get high blood sugar. Well, that high blood sugar can actually affect conditions in your mouth. Here are 2 of them: thrush or oral candidiasis, which is a fancy word for a fungal infection. Now, little warning here, I'm going to show you some pictures. If any of you are eating breakfast, you might want to be careful here as I show you some of these photos. But this can happen to anybody of any age. Even babies get this, but it's caused by an imbalance of the oral flora or bacteria in your mouth. And it's not permanent, it's temporary, but it can be very uncomfortable. It has a sting. It feels like it's stinging or burning sensation in your mouth. The other thing that people with diabetes present with more often is gum disease. Now, this is a picture of a healthy mouth with light pink gums and firm tissue. But when a person has gum disease, you'll notice that there are gaps in between their teeth and the gums are red and puffy and actually shrink. That's because the bone around your teeth are actually shrinking because of the bacteria that's inside your mouth that's creating your body to creating that bone loss. And this actually leads to loose teeth. Gum disease is actually the number 1 cause of tooth loss in adults, not cracked teeth, not cavities, but gum disease. And it's an unfortunate condition because it doesn't hurt. Now, that sounds kind of funny. You know, isn't it good that it doesn't hurt? Well, actually, no, because then you don't know all the destruction that's happening here. So what happens is, remember what that gap was? Some of you researched that term, starts with an S. That space between your gums and your tooth is the sulcus. And that's where the germs collect in the sticky plaque. We all get that plaque. It forms after we eat. And if it's not brushed away, that's what causes the gums to get red and puffy. That's gingivitis here, the first stage of gum disease. If that's not taken care of, then more permanent damage can be done where the bacteria actually makes the bone shrink, and that's periodontitis. Now, this is hereditary, so some people are more prone to it than others. It usually starts around maybe 17 or 18 years old. So if maybe, you know, you have family members who have lost a lot of teeth at once, it could be because of gum disease. Part of it can be controlled by keeping your teeth clean by brushing, but when that plaque hardens or you get mineral deposits like this middle picture of the calculus or tartar, you know, we've all heard about tartar controlled toothpaste maybe. That's when only a dental cleaning can clean that stuff off, because a toothbrush isn't going to be able to knock off. That stuff is like as hard as a rock. So that's when you see your dentist or dental hygienist, and we use our instruments to clean our teeth, just like you saw in the ThingLink video with the ultrasonic scalers and all that, so that we can reveal the teeth like this underneath. But you want to get that done on a regular basis before the permanent destruction of your teeth happens. So gingivitis and periodontitis gum disease is a really big thing for adults because it affects a lot of people. One thing, another tool that we use to help to see if somebody has gum disease is the x-rays. So I'll teach you a trick here that I teach my dental students. When we look at an x-ray, the tissue, the soft tissue like the skin and the gums don't show up. So we see these dark triangles here. This is the bone that is solid, so that does show up on an x-ray. And this is a healthy level of bone right near the neck of the tooth. Now, when we start to lose the bone and it starts to shrink, then the black triangles actually get bigger because now you have more empty space. So now you can look at an x-ray and you can see, oh, this person has some gum disease, and this person, hopefully your teeth look like this on the x-rays, most likely they do. And this might be somebody who's had gum disease for a long time, because it can take many years, even decades, to progress, which is good. But it's important to manage it when you first see it, because there's no cure for it. So once you lose that bone, it's gone. And we talked about people with diabetes who are more prone to gum disease. Well, people with diabetes are 2 times more likely to get gum disease. And now get this. People with diabetes who are 45 years and older who smoke are 20 times more likely to get severe gum disease, which means that they'll lose their teeth more quickly. So things that cause make you more at risk of getting gum disease and losing your teeth are it being genetic, how well or how well you, or how not well you take care of your teeth and brush away that plaque, having diabetes, and smoking. Those four things actually predispose you to losing teeth more quickly. And a lot of that you can kind of control, right? And that's what we're going to talk about today. And this is just another nice picture here. People who, there's something called meth mouth, and people who abuse methamphetamines actually get direct effects on their teeth, where it actually deteriorates your teeth, and can do so in a very quick manner. So this is how your teeth can just be devastated by things that you do to your body. And that's why you don't want to do that. Okay, now what happens when you lose teeth? Some of you asked questions about crowns and implants. Well, these are just some pictures that I want to talk about dental procedures. And sorry, that's a little bit lower on your handout. But we're going to talk about crowns and implants. A crown is when you have a tooth that has been broken down, either cracked or has such a big filling that, big cavity, that a filling isn't enough to plug it up. You actually need to put a cap on to hold the tooth together. So that's what this is. They used to be gold, and they still can be, but now people tend to prefer tooth-colored crowns. So there are a lot of great materials that have been, created since even when I went to dental school. So that's a great thing. The bottom picture here shows a bridge, and that's when you're missing teeth in between two teeth. That the problem is with the bridge, you need to actually shave down two teeth that can be perfectly fine next to the empty space, just so they can anchor the two middle fake teeth. It could be one or two. Those are called pontics. And this is fixed, meaning we cement it in. It doesn't come in and out. And so that can work really well. But sometimes people don't want to shave down the adjacent teeth, the neighboring teeth. So they like an implant. The implant is actually screwed into the bone, and the bone tries to integrate with it so that it actually becomes part of your jaw. It's a titanium rod there, and then we put a fake tooth on top. Now, all these three things are cemented or fixed in your mouth. This lower right option to replace missing teeth is a partial denture, and that is removable. It's sort of like a retainer with teeth on it. That's still a very good option for many people, especially since dental implants can be quite costly, and dental insurance usually doesn't cover most of it. This is just another picture of that dental implant. Somebody asked a great question. How is the titanium implant held in place during the process in which the gum grows around it? Excellent question. As you can see, and as I've mentioned, the rod is actually screwed in. You can see these threads on it, just like you were to screw into the drywall. It's actually kind of similar. So it stays put pretty well. And then we kind of stitch or sew the gums over it, because it takes about 3 to 6 months for the bone cells to actually connect to that titanium rod. It depends, everybody's a little bit different, but we don't put this fake tooth on until the integration happens. So that kind of keeps the implant staying put inside your mouth until it's ready to get that fake tooth on top. And then this is just a picture of 4 implants there on a person who has no teeth. And then we put something that looks like a denture right on top, but it makes it much more secure. This is an x-ray of the wisdom teeth here. Wisdom teeth are third molars. This is your first, second, and third molar. And not everybody even has all 4 of them. I only had 1. The other 3 never grew in. Other people get all 4, but most people don't have enough space in their mouth. If you are one of the lucky ones to have enough room in your mouth for your wisdom teeth to grow in straight, terrific, you can keep them and have another pair of teeth in the future. But if you don't have enough space, which most people don't, that's why the wisdom teeth grow in crooked like this. This is very common for it to grow horizontally like this and push against the tooth. This is just a diagram of the different positions that wisdom teeth can grow in, and it's all because of space, believe it or not. Now, people ask, well, when are wisdom teeth considered bad? You know, do you have to take them out? Somebody just asked me now, is it mandatory to get your wisdom teeth removed? Because I don't want to get mine removed and I'm pretty sure I have enough space. My teeth have slightly shifted, but it's nothing drastic. I would prefer to leave them in. So definitely good to have your dentist assess it and take a look at that. And there are many people that I've seen in my career where they were able to keep it. However, it could be very obvious when they're not going to grow into your mouth. And the reason why this is not good to have a wisdom tooth is because it's pushing into your good tooth right here. Can you all see that dark area right here? Well, that's actually a big cavity. And that was started by the pressure of this tooth pushing into that, in addition to food getting caught in this crevice here, right here, because the gums are here, but there's a flap right there trapping food and bacteria that you can't clean out. And that's another reason why impacted wisdom teeth are not helpful for you, because it actually increases your chances of getting other dental problems that can affect your good chewing teeth. So that's usually the number one reason why we recommend people taking their wisdom teeth out. Earlier than later is usually better. At a certain time, again, have your dentist assess it, because then you have a smaller tooth to pull out than to wait till it's fully grown, which makes it a little bit trickier. Okay, there's a YouTube video that you can all watch later, and it's a bit graphic. If we have time, we can, but if we don't, you can watch it on your own. It actually shows the actual procedure of a wisdom tooth being extracted, an impacted one. Okay, so we talked a lot about adult teeth. Let's focus on baby teeth. People ask me, well, why should we fix baby teeth? They just change anyway. The reason why you don't want to just wait till they change is because those baby teeth, this might be a good quiz question, are important placeholders for the adult teeth. This picture here shows the adult teeth growing in the bone, and it takes a while, like a couple of years, for it to fully go through this process. And the adult tooth actually pushes out the baby tooth when it's ready, and then it takes the place of it. But if you lose this baby tooth, like to cavities very early on, this adult tooth isn't ready. It won't just spring to action and take its place. Instead, it'll still take a couple years to grow in. And in the meantime, the other teeth will tip and block the space so that when this adult tooth is ready to grow through, it'll be blocked. And then you need a lot of braces and orthodontic work to fix it. So that's why baby teeth are important. But unfortunately, over half, 60% of kids ages 5 to 17 have dental cavities, which is a big dental problem. You learned a lot about cavities on ThingLink and what causes it. So this might be a good quiz question too. And what happens is that baby teeth are very thin, so they can get cavities very easily. It starts off with these white spots. You might even be able to see it in your little brothers or sisters if you lift up their lip. And then it transitions into holes in the teeth until a lot of tooth structure can be literally dissolved away down to the nerve, which can cause possible pain and infection. So one tip I wanted to share with you all, I'm not sure if I had mentioned it last time or not, but this is a really important one, is people say, okay, sugar can cause these cavities or lead to them. Well, what happens is that when we eat anything, that we get acid in our mouths, and the bacteria in our mouths use what we eat to create this acid. And it depends on how long this acid is in your mouth that will lead to more cavities. So if I had 6 pieces of candy, okay, if I eat all 6 pieces at once and don't eat anything for 1 to 2 hours except water, I'll get fewer cavities than if I ate 1 piece every 10 minutes for that hour. And that's because my teeth aren't being exposed, or that's because my teeth are being exposed to sugar and acid longer if I stretch out the same number of pieces of food, whether it's candy or oranges. Yes, somebody asked, if we're snacking, that's why snacking is so good, isn't so good, but is snacks that aren't healthy that we should reduce, or just reduce snacking in general? Well, unfortunately, even healthy food, snacking with healthy food, can increase your chances of getting a cavity. So this is a picture of oranges, and it's healthy for our bodies, but it still has natural sugar in it. So again, you want to group your food, because you have to eat. You just want to group your meals. You can even add on a dessert, but then don't eat or drink anything for an hour or two, and you'll get fewer cavities. So we know we want to eat healthy foods, not too much juice. You'd rather eat the fruit than the juice, something with more nutritional value, and then be careful of things that disguise themselves as being healthy. Like granola has a lot of sugar, a lot of hidden sugars in it. Oh, I love chocolate milk, so that's a tough one for me. But it actually has twice as much sugar than regular milk, and not any more nutritional value. Okay, fruit by the foot. Oh, one of the worst because it's sticky, so you want to avoid sticky things too. Very important. There's a lot of hidden sugars in drinks, not just candy, but here's my favorite, the boba drinks. But luckily, you might be able to adjust the sugar level. A lot of people love agua fresca and, horchata. That all has sugar in it. And as a treat, it's okay. But you want to, again, maybe drink it once in a while, like a treat, everything in moderation, right? And tap water is good for you because it has fluoride. Remember, we learned about fluoride ions in the ThingLink videos. Fluoride can actually help remineralize teeth that we lose during the acidic process. So it's a constant process, actually. We lose minerals and then we remineralize, and drinking tap water helps that. Brushing twice a day, physically removing the food on our teeth and the plaque and the bacteria is very important. We want to brush 2 minutes twice a day. 2 minutes is actually a long time. Electric toothbrushes are good, but be careful not to overdo it, because remember what I mentioned about the fragile gum tissue? I had a patient that actually wore her gums away like this. This isn't her, but it looked just like it within 3 months of starting to use her new electric toothbrush. So you always want to move it along, keep it moving. Don't stay in one spot too long. Otherwise it can lead. This is irreversible. The gums don't grow back when they're worn down. So you need gum grafting, a minor surgery to actually replace it. And then this exposed root can sometimes lead to root sensitivity. You hear about adults talking about that sometimes, like, oh, I can't drink cold water because my roots are sensitive. It's because the root is exposed, and there are some toothpaste out there that can address it. It has this extra ingredient called potassium nitrate. So if you look at the label and it has potassium nitrate, it can help with your root sensitivity. You can tell that to your parents or grandparents. All the things that we've talked about can help you take care of your teeth better. And ultimately, the other piece of the puzzle is getting regular dental checkups, because there are things in your mouth that you won't know that's happening, dental problems that you can catch early if you see your dentist earlier. Somebody asked a terrific question about, well, what happens if you can't afford to visit a dentist twice a year? And that's a really good and difficult question. Now, for kids, if you can't afford dental care, the great thing for kids is that people up to the age of 21 can qualify. I think it's 20 or 21. We have to check because they've changed it. Can qualify for state insurance. It's a public insurance program called Medicaid or Medi-Cal, and you can get a lot of dental care covered with that. For adults, it's a different story. Many people don't have dental coverage, and it's really difficult for them to find dental care. Some of them might qualify for Medi-Cal, some of them might not, and others might seek emergency treatment at local hospitals or clinics. But that's an issue that I hope your generation continues to explore. Anybody interested in public health? Those are the things that we're always trying to figure out. But in the meantime, again, if you try to take care of your problems earlier, you'll have fewer dental problems when you get older. So we dentists are actually recommending kids see the dentist by the age of 1, by their first birthday. My colleagues and I will share our stories with you and describe what role we play in the dental office. So let's go ahead and have our panelists introduce themselves. We'll start with Dr. Tori Rothstein. Dr. Tori?
Hello, everyone. Thanks for having me. My name is Tori Rothstein. I'm a dentist. I work at Sonrisas Dental Health with some of the panelists you see here today. I did not always know that I wanted to be a dentist. I remember being where you are now and just knowing that I wanted to do something in the health field. I, at some point, had to realize that my grades needed to be better. And so I started working pretty hard to get them to where I think they needed to be just to get into college, which was sort of the first step, going to university before dental school. So I went to UCSD down in San Diego. I majored in mammalian physiology and neuroscience, which sounds really hard, but it's not as difficult as it sounds. It's not easy, but it's something, it's manageable. You know, one class at a time, one fact at a time. It's totally possible to learn it all and progress. During my time in college, I had to make a decision about what I wanted to do with the rest of my life. I shadowed a few dentists to see what it was like to be a dentist. I had only seen dentistry through my father, who is an orthodontist, but orthodontist is a little different from a general dentist. Orthodontists, you may know, place braces and make teeth straight, and you know, that Hollywood smile. Whereas general dentists are those dentists that you see, you know, once every 6 months, where you go for a cleaning, a checkup, maybe some fluoride varnish. If you have cavities, you go in for a filling. I wasn't sure if that's what I would want to do with my life. So I shadowed. I contacted some dentists and I watched what they did for a day or two. I tried to see dentists in different environments so that I get a good sense of not just what one dentist does, but what many dentists might do. And I enjoyed what I saw, so I applied to dental school. I went to University of the Pacific Dental School up in San Francisco, which is a 3-year dental school, whereas most other dental schools are 4-year universities. So, and I told myself, you know, I've seen what a dentist does, but that doesn't mean I'll like being a dentist, right? Because those are two different things, you know, liking what something looks like, liking what you see other people doing, but then having to experience it for yourself and be like, oh, I do like this. And luckily that's how it turned out for me. I told myself I would give myself a year and just try it. And if it didn't work out, if I didn't enjoy what I was doing in that year of dental school, I would find something else to do with my life. And I enjoyed it though. I stuck with it and became a dentist. Graduated in 2005. And then for 15 years now, I've been with Sonrisas Dental Health as a dentist. In between being where I am now and graduating dental school, I experienced dentistry in different facilities, different offices, a private office, a group practice where there's many dentists, not just one, and then a private nonprofit dental clinic like Sonrisas Dental Health, where I found that I really enjoyed dentistry, where I enjoyed being able to give back to the community, to help people who maybe didn't have anywhere else they could go because of finances or some sort of other eligibility issues. We were there to try to improve their dental health. Sometimes it's trying to get somebody out of pain. Other times it's just trying to teach a little kid how to brush their teeth well so they'll never be in pain. But that's sort of my story of how I ended up where I am today. And I look forward to some of your questions as we go on today. Thanks.
Thanks, Dr. Tori. I think what a lot of people don't realize is that, you know, when you think of the dentist, you don't necessarily think of a team effort because the dentist is the one with their hands in your mouth. But as a dentist myself, there's a lot that I can't do or wouldn't want to do without my dental team, especially my dental assistant, who makes everything easier and more possible to do really good dental procedures. So we have Maggie, who is a dental assistant at Sonrisas. Maggie, can you share your story with us?
Yes, I can. Thank you, Dr. Bonnie. Hi, everyone. Thank you for having me here. My name is Maggie Mata. I'm currently a dental assistant at Sonrisas Dental Health. I started doing dental assistant 4 years ago. Sonrisas has given me the opportunity to pursue to be a dental assistant. It was never in how it all started. It has never been like in my head. It was nothing I wanted to do. All I was doing at the time before I started being a dental assistant was coaching. I'm a soccer coach. I've done a few courses throughout my years. I used to play soccer as well. But one day I moved back into Half Moon Bay, my hometown, and I decided to do something else besides coaching. And I went and applied, and they were just hiring for a floater. That is front desk and also helping the clinic side when they needed. When it all started, when Sonrisas in our Half Moon Bay office, they lost two of their assistants or their RDA, and they just left me back there with two of our doctors, and I became an assistant. I didn't know anything, no background in dental assistant. I slowly learned more about it. It was at first, it was very hard. I didn't know what certain stuff was. I always kept asking the doctors, what does it look like? Because I was alone in that office a couple months until we got more help, more dental assistants that knew more about it. So through the years, I've been learning more and more every day. Now it's just easy on me. I'm still learning. Every day it's a new thing. Every day I learn a new thing, especially when I have to work with different doctors, not the same ones at all time. And that's pretty much it of my dental assistant journey. So thank you for having me.
Thank you, Maggie. You bring up a really good point about dental assisting. In the dental assisting positions, you can actually learn most of what you do on the job. And that's sort of the nice thing about the dental field, is that there's many different routes to where you might want to go. Well, Maggie mentioned some different terms that we use in dentistry a lot, like front desk, the back, floater. Like with every profession, there's going to be different types of terms that we use to define different roles that we play. Front desk, you might be wondering, well, what's that? That's sort of like an informal phrase that we use for a person like who's the receptionist or who greets the patients, who answers the phones, as opposed to the back, where it's more clinical. And that's where the dental assistants, hygienists, or dentists work and do the dentistry. So Irma is one of our care coordinators. The care coordinators really are sort of the backbone of the office, in my opinion, because they're the first person that the patients might talk to when they call in, and the last person that they speak to when they leave the office. And she helps to coordinate the care, to make it run smoothly for the patients, and the clinical staff. So Irma, please go ahead.
Hello, good morning, and thank you for having me. My name is Irma Ochoa, and I am a patient care coordinator here at Sonrisas. I enjoy what I'm doing, which, like Dr. Bonnie said, is I could be the first person that patients contact. It could be via the phone, or some patients come in and knock on our door because they're looking for a dentist. My job is to collect information from the patients, insurance information, creating charts on our system, scheduling appointments, verifying their insurance, and then a couple of days before their appointments, we call patients to confirm appointments, to do the COVID-19 screenings. And on the day of the appointments, patients come in. Usually I email the forms ahead of time so they can email them back to me, and I can update the chart. And it's important to translate all the information that they've given us onto the chart to make sure that we have everything accurate, because if we don't start the chart correctly from the beginning, we will have problems later with whether it's with insurances, or if we don't have the correct contact information. So it's very important that we are starting the chart correctly. On the day of the appointment, patients call us when they're in the parking lot. We ask them the COVID-19 screening again, and we come out and take their temperatures before they're allowed to come into the clinic. Throughout the day, I'm on the phone a lot, whether it's confirming appointments, doing screenings, taking new calls for potential new patients. So it's a multitasking role. So as Dr. Bonnie said, as patients coming out, we need to schedule their follow-up appointments. And so that's basically what I do throughout the day. Is very busy. The main reason why I chose to be in dentistry is because I enjoy working with people, helping people. I'm originally from Mexico. I came to California when I was 12. because of financial reasons, my parents couldn't afford to take me to a dentist ever until I came to California, and through a community program, I was able to go to a dentist, and I had 16 cavities at the time. And I'm very grateful because it was free dental work that was provided to me at that time. And my father was a farm worker. And so I'm very grateful that I was able to receive that dental help at my 12 years of age. And that is one of the reasons I want to give back to the community. And that's one of the reasons I enjoy working here at Sonrisas, because we help the community, and I want to give back. And thank you for having me.
Hello everyone, my name is Brenda Barrientos and I am a registered dental hygienist. A little about myself is that I moved to the Bay Area from El Salvador when I was 11 years old. As you may have figured, English is my second language. I am also first generation college graduate. I received my associate's degree from College of San Mateo, my bachelor's degree from University of the Pacific, and my master's degree from University of California, San Francisco. As a dental hygienist, I aim to care for my patients' needs by providing different kinds of procedures, such as cleanings, deep cleanings, injections, counseling, among others. I also make sure that my patients' needs outside of my scope are also met. This means that I need to collaborate with the dentist and the rest of the dental team in order to make sure my patient is well taken care of. You may ask yourself how I ended up where I am today. Well, it all started when I was in high school and I did a project. I researched how to become a dentist. I was both excited for what I found because I really liked the dental field, but at the same time, I was disheartened because I thought that this dream was unattainable. I didn't let that stop me, and I did start to volunteer at the dental clinic, one of the local clinics in my community. And one of the days, I actually started to assist the hygienist. And I really enjoyed not only the focused procedures that she had, but also enjoyed the communication she had with her patients. From that day forward, I began to map my way to becoming a dental hygienist. The first step involved taking the prerequisite courses at the community college. Then, I decided to become a dental assistant. This would help me pay my way through a dental hygiene school. California. To this day, I still use the knowledge I gained as a dental assistant, and I find it very valuable and one of my most treasured experiences. You may be wondering what a day is like in the life of a dental hygienist. Well, in my case, it may be different depending on which day of the week you ask. One day, I could be teaching dental hygiene students at the university. On another day, I could be at the dental office, like Sonrisas, taking care of 8 beautiful smiles. On another day, I could be going to a school, like yours, and do screenings. And on other days, I could be volunteering or helping out at a health fair.
As the business owner, what do you look for when you hire your staff members, like the dental assistant or the receptionist, care coordinator, or the dental hygienist?
Yeah, that's a very good question. Yeah, part of it is being qualified, maybe having the right degree and having some experience. But what's really important that I really look for is someone to be friendly. I mean, you can't teach friendliness. You can't treat kindness and sincerity. So that's really kind of a key thing that I'm always looking for. I'm also looking for if someone's very organized in their thinking. They're not kind of all over the place. And then, of course, like I said, knowledgeable. So those are probably the top 3: friendly, organized, and very knowledgeable of their position.
I'm glad you mentioned that, because sometimes we get caught up in degrees and schooling and everything, which of course is a big part of it. But those 3 things, I bet most, if not all, the students that we're speaking to today have the ability to do that, right? So it's like you guys are already now qualified to enter in to the workforce in the dental field. Somebody has asked a really good question here in the chat. You mentioned a lot about billing. Is there on-the-job training? We're going off script now, Dr. Rowland. You mentioned a lot about billing. Is there on-the-job training or education for care coordinators? Like, how do you get this experience if you're, say, coming out of high school or just entering college?
Yeah, that's a very good question. a lot of offices do on-the-job training, and that's really good that you have, if you have staff that's able to kind of train someone as they come on board. But usually when with my staff, and this is what I'm doing right now, I recently hired someone and they have some experience already, but they don't know everything how my office runs, because every office is a little bit different. And so what we're going to do is we train them a little bit of our systems, our procedures, our codes, how to bill with our system. And then what we like to do afterwards is have someone else come in from our software company who helps train in regards to doing other billing concerns. And so there's additional training that comes in that we draw from our group of people that we know to come in and do some additional training. But a lot of it's done on the job. Yeah, so very good question.
So that seems like a really attainable position then from somebody at a, let's say, entry level, or where maybe they're trying to work part-time and supporting themselves through school.
Oh, definitely. If someone's interested in the dental field, they have the eagerness and willingness to learn something new and be friendly, then, I mean, it's open. It's very open for someone to come in to do that.
Wonderful, wonderful. Well, I know this video was part of another presentation that I had given, and I was trying to fit a lot of information into a short amount of time. So I'm sorry if I was talking a little fast during it. Please feel free to ask me any questions now that you have about anything that was mentioned during the video, or something that has not been covered yet. You might have heard something about quizzes or quiz questions, but no, don't worry. You're not going to be getting any test questions about this. Just want you to sit back and enjoy the information. It also mentioned something about ThingLink, which I believe you all might have gotten a link to. That is an online module that you are welcome to explore. It talks a lot about how to take care of your teeth, different dental procedures, some tidbits about, dental career options. And I'm going to go ahead and just show you what that looks like so that you're familiar with that. Okay, this is just the intro, and it's an interactive online module that it's like a tour of a dental office. You can see our sterilization lab. We talk about what we do there. We talk about different dental procedures. So you can go ahead and explore that, and, at your own pace. Okay, great. And, oh, I have a question. Thank you. The question is, can a cavity be reversed? Terrific question. I love this. I hear that a lot of you are studying physiology right now. I think that's wonderful, because physiology and biology were some of my favorite subjects in school. And let's start off actually first to answer that question about cavities, because we didn't cover in the video. What exactly is a cavity? Okay, I'm going to put on my glove here so that you can see this a little bit. Well, basically, we're all familiar with what teeth look like, right? You have your gums, and then you have your nice pearly white teeth. Well, let's show you a cross section of a tooth and what it looks like inside. These are the different layers. The outside is the enamel. It's like a hard turtle shell. The inside is a little bit softer, but still firm. It's called dentin, and it actually does look more yellow than the white. And all of that structure is there to protect the very valuable, very important nerve inside your tooth. If I were to tap on your tooth or even drill on your tooth on the enamel, you probably actually wouldn't feel it until it got closer to that nerve. Well, what a cavity is when there's acid in the mouth, the acid can actually dissolve that tooth structure and create a hole. So I know you're probably familiar that a cavity is a hole in the tooth, and it starts off really small. And then once it gets through the enamel shell, it can actually spread much more quickly and look like this. So the black part is basically just decay in the tooth. It's like wood rot. It's softer, it's mushy. And if you don't drill it out, which a filling does, it actually starts to get closer and closer to the nerve until the decay enters the nerve and the nerve starts to die. And then that's when you need what's called a root canal. And a root canal is basically a procedure that is done to clean out the inside. So can a cavity be reversed? This cannot be without a filling. It can be stopped from progressing, but it can't be reversed. This may be at this stage. Okay, so if you basically have some demineralization, think about putting acid on glass or a mirror. You get that kind of etched, texture. That's what actually happens to the enamel. At that stage, fluoride that's found in your toothpaste, that's found in prescription toothpaste, that's found in fluoride mouth rinses, can actually remineralize the tooth and reverse it. However, the more sugars that you eat, the faster the etching process happens. So it's kind of like a race. It's a race and a balance between how much sugar and acidity you have in your mouth versus how much fluoride and ions that you can have in your saliva that can remineralize the tooth. So that's why it's really important to be careful of what you eat and how often you eat it, just like we mentioned in the video. So thank you for that question. Oh, wow,
Bonnie,
they're just all pouring in.
yeah, so I'm going to help you out here. You
Okay.
have a few questions or several related to the process of becoming different levels of dentistry, what classes to take, major or minor, how you can volunteer, what that process is, how to become a dental assistant, and or how long it takes to become a dental assistant after high school, and how long it takes to pursue other careers. So maybe you can wrap those together.
Okay, sounds great. Thanks, Dee Dee, for giving me that package of questions. Well, definitely there are lots of different levels of career options in dentistry. And I'll just start off with becoming a dental assistant or a receptionist or care coordinator, because that's something that you could probably actually do right now. It doesn't take any special training, although there are higher levels of education to give you a license that allows you to do more in that role. But you can actually just start off with, applying to a job, and some offices are actually willing to train you give you on the job training. Again, as the video had mentioned, Dr. Chu had said what he's looking most for is the type of person you are, the type of personality, because you're working with the public, you're working with people. So you want to seem approachable, because if you can imagine, people are already a little bit nervous walking into a dental office. And if you're the first person that they're going to see, it really makes an impact, on their visit. So if some of you feel that you can be friendly or be caring about people, that's already the first step, okay? There are dental assisting programs that will teach you how to do more. There are volunteer opportunities, not so much internships at that level, but there are different dental assisting programs at community colleges or other ones that you can find online. In regards to the next level of care would be like a dental hygienist or a dentist. That's where you need more formal training. So you actually need to go to an accredited dental hygiene program or dental school. The difference between the two roles is that dental hygienists focus more on the gums. We talked about gum disease and trying to prevent that, and cleaning the teeth. Whereas the dentist can also do that, but in addition can fix teeth and fix cavities, restore them, do dental implants, do dentures, things like that. So for that, it's very science-based. But don't give up. Like I said, I loved biology. Chemistry and physics, which are required to become a dentist, was a lot harder for me, and I had to study a lot more for that. But so it's like with many fields, it's very competitive. So you have to get a certain GPA level in college in order to qualify for dental school, which is considered a graduate level program. So you would, finish high school, go to four-year college, or you could start off with a 2-year community college and then take additional courses, get your bachelor's degree, and then apply to dental school and take an entrance exam. So those are the steps to go into dental school, and very similarly, hygiene school as well. In regards, there's also, if you like working with your hands, you could also be a dental lab tech. They work with models and stone, and they actually create the crowns that we place onto the teeth. And so, this is, again, the teeth. This is a cross section of your teeth. And, we drill the tooth. So this is what a tooth looks like when the dentist drills out all the decay, shapes it, and the lab tech makes the crown that we then cement right onto that prepped tooth, so to speak. This is actually an implant here too. Then one
Dr.
last thing.
Chu-
Oh, yes, go ahead.
No, I was going to interject. Would you mind mentioning the names of any schools for dental hygiene, for dentist training?
Oh,
that
sure,
different
yes.
schools-
For so dental hygiene, which is like a 2-year program that can also be taken in conjunction with college, is there are some nearby: Foothill College, Chabot, De Anza, University of the Pacific in San Francisco. So there are many different ones in the Bay Area. For dental school, the ones locally, we're really lucky to have 2 in the Bay Area, are UOP, University of the Pacific, Arthur A. Dugoni School of Dentistry, that's a mouthful, and UCSF, University of California, San Francisco Dental School. And then there are lots of for dental school. A lot of times people will apply for a lot of out-of-state schools or down south. So, but we don't want to get too ahead of ourselves. Don't feel overwhelmed. You just take it one step at a time. It's helpful to shadow a dental office as well to see if you even like that profession. When you start seeing us pull out teeth or start scraping up gums and they're bleeding, some people find that they love it, and other people feel that I think I need another field.
So I'll just jump in with a couple more here. Can alcohol damage teeth? And another one is can you talk about the sticky plaque on the teeth?
Yes.
And just cover those couple.
Sure. Yes. Great questions. So alcohol, it depends. It can be acidic in the mouth, and it depends on how often you're drinking it. Like with anything, even fruit juice. Now that's very different from alcohol, but anything that has any type of sweeteners, sugar, or that causes acidity in your mouth, if you're taking a sip every 5 to 10 minutes over 1 to 2 hours, which many people do, sometimes if they're, say, at a party, you're 21 years old or over, and you're at a party and you're kind of like nursing that drink, you're sipping it, that frequent exposure to the acidity and the sugars can actually give you cavities more so than if you were to drink something at once and then don't drink or eat anything for an hour or 2. So that kind of can apply to a lot of different types of drinks. Alcohol also in moderation can be okay, but a lot, there's studies that show it actually can kill brain cells. So I actually was always very careful with alcohol because I needed all the brain cells I could get, and to keep the ones I had. So that's another topic though. But of course, anything in excess is not preferable. In regards to plaque, the plaque biofilm, what we call it, is actually an organic matter that develops on the tooth structure within 24 hours of eating. And the reason plaque is not good is because it actually harbors the bacteria that poops out acid. That's right. You heard me say it. The germs in our mouth live in the sticky stuff on our teeth. You can scrape it off and see that white yellow stuff. I know it's gross, but that's what dentistry is. That's the plaque, and the bacteria eats the foods that you take in, and their waste product is acid, and that acid then eats through your tooth and causes the cavity. Thank you. And Didi, are any other questions that you see there?
How long does it take a cavity to form? And how long until the root is affected? And I'll just throw out one more. Are patients awake during implants? How do you decide what kind of anesthesia to give?
Okay. Whew, great questions. Well, in regards to how long does it take for a cavity to form, it depends on how thick your enamel is and how acidic your mouth is. So some people are born with thin enamel. Kids' teeth have very thin enamel. And so just like with anything, if it's the thinner it is, the faster the acid can work through that protective layer. It's like a shield. I watch a lot of Star Trek, and you know how they get bombarded with lasers, and it depends on the percentage of shields that they have up. It's the same with the enamel. The longer that the enamel is being bombarded by the acid, the more quickly it will start to decay. So for instance, I have a tooth that, and an adult tooth, it could take many years for a small cavity to get bigger. Okay. Whereas I have a cavity that I've been watching for about maybe 10 years, and it hasn't gotten bigger, thank goodness, because I brush and floss. I brush twice a day. I floss at least once, and I try to monitor the sugar, which is hard because I have a sweet tooth. And so far that cavity hasn't gotten much bigger where it needs to be filled. In a child, I could see a cavity forming within 3 to 6 months, or I can see a small cavity turning into a big one at the next appointment, which is half a year. So what a huge difference, right? Last thing I mentioned about that is the dentin, it's a little softer. So it's like metal and wood. Once the decay hits that junction, that border right there between the enamel and the dentin, that's actually when it spreads more quickly. So that's why I say if the decay stays in the hard enamel, it doesn't grow as quickly. And I'm sorry, Didi, what was the second question in that you had asked about how quickly does a cavity form? Dental implants, do you need to be asleep?
Yes.
Yes, actually, no, not really. A lot of people do really well with getting implants with being awake. They just need to be numbed up, of course, because you're working in the gum tissue. And so local anesthetic, like you might get when you're doing a filling, is sufficient. And I hear that people who get dental implants, I've never gotten one, but I have a cracked tooth, so I might in the future. It heals up within a few weeks. So it's not as uncomfortable. Mm-hmm. So somebody asked about sticky foods. Yes, sticky foods that have sugar in it, they actually can cause cavities more easily because why? They stick on your tooth longer. And I remember I mentioned the frequency and how long that tooth is exposed to acid. That's important. Somebody asked, my parents want me to get an electric toothbrush. When I'm not comfortable with it, can I still prevent cavities and tartar buildup with a regular toothbrush? The answer is yes, you can. There are studies that show that an electric toothbrush can brush some areas a little bit more effectively, but you can do just as good a job with a manual toothbrush if you're doing it the right way. You want to use a soft toothbrush and brush for 2 minutes. 2 minutes twice a day with some fluoride toothpaste. Will actually help to strengthen your enamel and prevent cavities. But remember, even with a regular toothbrush, you can cause that gum recession that you saw in the video. So don't brush too hard, even though you just, so use a soft toothbrush. Okay, tartar is different though. Plaque biofilm, it's sticky. Tartar, that's the hard, crunchy stuff that forms on your teeth. The only thing that can really take that off is going to the dentist and having them use their special instruments to clean that off, okay? How is it different getting a tooth removed at the dentist office versus getting it done at home? Usually the teeth that come out at home are already baby teeth. And the reason why they get so loose, they're loose enough to, fall out by themselves is, okay, I'm gonna show you something. This is my baby tooth. Thank you. And yeah, that's right. There's more filling material than there is tooth. I had 13 cavities by the time I was 3. So don't feel bad if you have cavities. It happens to everybody, okay? And my dad's a dentist. So, but yes, that's what happens. The baby tooth actually loses the root. You know how I showed you that other tooth that has roots inside the bone here? As the baby tooth changes, they actually push out. The adult teeth actually grow, and let me see here. These are the blue adult teeth, they actually push against the baby teeth, dissolve the root, and then all you're left with is that crown that then is wiggly enough to fall out at home. At a dental office, you're usually getting it pulled out because there's more of the root structure and it's not as wiggly. Okay, and let's see. What are some colleges that specialize in dentistry? I'll mention that. And how would your teeth be affected if you miss a day or two of brushing and flossing? Well, I'll let you know that maybe a day or two would be okay. But remember, I mentioned about the balance. The more acid you have in the mouth that doesn't get neutralized, the more quickly you get decay. So a day or two may not make a huge difference, but I'd say a few days in a row could. So you want to be careful of that. They tell you to brush after meals. Brushing twice a day for 2 minutes a day is good, but wait about half an hour before eating something, especially something acidic like oranges or something sweet, because during that half hour, your teeth are actually microscopically a little bit softer. And if you're brushing, you could actually brush some of the tooth structure off microscopically. So ideally you want to wait, you wait half an hour and then you brush. Okay, but I brush my teeth a lot before I go to bed because when you go to sleep, your mouth dries out and you get cavities more easily. So if you had to pick one time to brush your teeth really well and floss them, do it before bedtime, before you go to sleep. And somebody asked me, what are some majors and minors to take in order to pursue dentistry? Well, actually, you can take any major or minor. You can be an art major, you can be an English major, or you could be a biology science major. The key thing is you have to take some required courses, a year of biology, a year of chemistry, a year of physics, and I believe a year of organic chemistry. Okay, so those are the 4 main courses that the minimal that you would need to take in order to qualify for dental school. But there are some good websites online that actually spell out exactly which courses and maps out a plan for you if you're interested in dentistry. And what motivated or influenced my journey on becoming a dentist? Well, I mentioned that my family had a dental office. My dad was a dentist. And so that gave me some initial exposure that you can also get if you volunteer or shadow at a dental office. And that gave me an idea that, oh yeah, I feel that that's interesting. But as Dr. Tori had mentioned in the video, you're studying about it and actually doing it are 2 different things. So sometimes you just kind of have to take that leap of faith with any type of career option. I did really like to see how by treating patients, by working with them, that many of them were very grateful for the care that they had gotten. And so that's really influenced me throughout my career, is that I wanted to be able to provide dentistry at a level in which it was where I had the patient's best interest at heart and where I am helping the community, which is why the main focus of my career now is community oral health and working with community members. I find that very fulfilling, and you all can do that too just by volunteering.
So Dr. Ju, I think we can wrap up today. You've been phenomenal about answering all these extra questions, and this will be wonderful, not only for those who are with us live, but also for everybody who's going to be joining us asynchronously.
Thank you. Thank you, Dee Dee. Again, as I had mentioned, I loved teaching people and helping them learn more about how to take care of their teeth and also helping people with their teeth. And I appreciate this opportunity, everyone, and all of your attention.
Please, students, go ahead and scan this blue QR code. All survey takers are entered to win an Amazon gift card, and we would just absolutely love your feedback. Thanks, everyone. Have a wonderful afternoon.